All right, let's dive right into this deep dive about lupus. We've got your medical info and a ton of research here, ready to break it all down for you. Lupus is a real tricky one to diagnose, kind of a chameleon.
Yeah, it really is like solving a puzzle, but the pieces keep changing shape.
That's a great way to put it. And speaking of puzzles, in your medical history, you mentioned fatigue and joint pain. And while those could be signs of a lot of things, they're also common with lupus, so that's why we're here today. To really understand this, got to start with the basics, right? Lupus is an autoimmune disease, meaning your immune system, the one that's supposed to be fighting off the bad guys, well, it kind of goes rogue and attacks your own body.
It's like your immune system is a guard dog that suddenly turns on its owner. Instead of protecting you, it starts causing all this damage and this
Yeah.
friendly fire. It can happen anywhere: skin, joints, organs, even your brain.
Wow, okay. So not messing around then. You also specifically asked about the butterfly rash, the one you always see in those medical pictures. You know,
Mm.
that reddish rash across the cheeks and nose.
Yeah, pretty distinct, and it is present in a lot of lupus cases. BUT, here's the catch. Not everyone with lupus gets it, and a ton of other things can cause similar rashes. So it's not a slam dunk for diagnosis.
So we can't just go by one symptom, huh? Makes this deep dive even more important. Now, you mentioned a family history of autoimmune stuff in your notes, and this is where the whole genetic side of lupus comes in.
Right, it's like inheriting a blueprint that makes you more susceptible. Doesn't mean you'll definitely get it, but it ups the chances. And then it gets really interesting because even with those genes, something has to actually trigger the disease.
Okay, so it's not just what you're born with. There's an environmental piece too, kind of a double whammy.
Exactly. Think of it like a loaded gun. It might just sit there, but the potential is there.
Hmm.
Then something in the environment, boom, it pulls the trigger. And one of the most well-known triggers is sunlight.
Really? Sunlight, I mean, everybody needs a little sunshine, right?
Of course, but for folks with lupus, sunlight can act as a catalyst, can trigger flares, especially with skin stuff, but it can also worsen things internally too.
Wow, so something that's good for most people can actually be harmful for someone with lupus. That's kind of wild.
It really highlights how complex this disease is, yeah. And sunlight's just one piece of the puzzle. Infections can also play a big role.
Infections. How do those fit into lupus?
Well, imagine your immune system's already on high alert. Then you get an infection, throws everything into overdrive, can trigger a lupus flare or make existing symptoms way worse.
So it's like the infection sets off a chain reaction, and the immune system just goes haywire.
Precisely. And here's what's even more crazy. Even some medications can cause symptoms that look just like lupus.
Wait, hold on. You're saying taking a medication to treat one thing could actually make it seem like you have lupus.
Exactly. We're talking about certain blood pressure meds, anti-seizure drugs, even some antibiotics. This makes diagnosis even tougher because what looks like lupus might not be the real deal.
So it's like a medical mystery. Got to look at all the clues carefully. Speaking of figuring things out, who's most at risk for developing lupus in the first place?
Well, your sex is a big one. Women are way more likely to develop lupus than men.
Is there a reason why?
Not totally clear, but researchers think hormones probably play a part.
Okay, so sex is a factor. What about age? Does that matter?
Definitely, age is definitely a factor. Most diagnoses happen between 15 and 45, though it can happen at any age.
Those are like prime years.
Mm.
So it's not usually a childhood thing, more like something that shows up later.
Right. And another key factor, which you mentioned earlier, is race. African Americans, Hispanics, Asian Americans, they have a much higher risk compared to Caucasians.
Wow, that's a big difference. So it's not just age and sex, it's genetics and ethnicity too.
Okay, so we've talked about what triggers lupus and who's most at risk, but what about the long-term stuff? What happens if lupus is left untreated?
This is where it gets really important to understand that lupus can affect almost every organ system. And those complications, they can be serious, even life-threatening in some cases.
So it's not just about some aches and pains. This is about real damage to your body.
Exactly. One of the organs most often hit by lupus is the kidneys. Kidneys. What happens to them?
Lupus can cause inflammation and damage to the kidneys, leading to something called lupus nephritis. And in severe cases, this can lead to kidney failure.
And kidney failure, that's pretty serious, right?
It is. Actually, it's one of the leading causes of death in lupus patients.
Wow. Okay, kidneys are a major concern then. What other organs are at risk?
Well, like I said, lupus can attack pretty much any organ, but besides the kidneys, the brain and nervous system are particularly vulnerable.
So not just physical health, but mental health too.
Absolutely. Lupus can show up as a bunch of neurological symptoms, from headaches and dizziness to more serious things like seizures and even strokes.
That's scary. What about those cognitive effects you mentioned before?
Right, lupus can affect how your brain works, leading to memory issues, trouble concentrating, even speech problems can be super frustrating and debilitating.
It's like your brain itself is being attacked by this disease.
That's exactly right. And we can't forget about the impact on the cardiovascular system, the heart and blood vessels.
Oh, right. Heart issues are a big deal these days. How does lupus affect those?
The lupus increases the risk of blood clots, heart attacks, and other cardiovascular problems. It's kind of like a domino effect. One problem can lead to another.
And you mentioned lungs before too, right? What kind of damage could lupus do to those?
Lupus can cause inflammation in the lining of the lungs, making it painful to breathe. It's called pleurisy. There's also risk of bleeding into the lungs and a higher chance of getting pneumonia.
Sounds like lupus can really affect the whole body. It's not just one isolated thing.
You got it. It's a systemic disease, meaning it can affect multiple organ systems at the same time.
And on top of all that, there are even more risks that come with having lupus, right?
Unfortunately, yes. One of the biggest is a weakened immune system.
You mean because lupus itself is an autoimmune disease, and then the meds used to treat it can suppress the immune system even further?
Exactly. It's a double-edged sword. The treatments that help manage the disease can also make you more vulnerable to infections.
So someone with lupus could get really sick from something that a healthy person might just shrug off.
That's the tough part, yeah. And it's especially worrisome with all the health challenges in the world today. A simple cold or flu could be much more serious for someone with a compromised immune system.
So even those everyday bugs can be a big deal.
Mhm.
Are there any other risks tied to lupus?
Well, the risk isn't huge, but it's worth noting that lupus slightly increases the risk of certain cancers.
That's scary to think about.
I understand. It's important to have all the information, even the tough stuff.
And you also mentioned pregnancy complications.
Yes, that's a crucial one, especially if it's relevant to you. Women with lupus have a higher risk of problems during pregnancy, things like miscarriage, high blood pressure, premature birth.
So having lupus can make pregnancy much more challenging.
It can, but it's not impossible. With careful monitoring and management from a healthcare team, lots of women with lupus have healthy pregnancies and deliver healthy babies.
Okay, good to hear. But still, a lot to consider. So far, we've covered a ton. Lupus sounds like a really complex and potentially serious condition.
It is, definitely. But it's also important to remember that with the right treatment and management, people with lupus can live full and active lives.
That's reassuring to hear.
Uh,
And that's what we're going to get into next, the steps people can take to manage their lupus proactively.
Yeah.
But before we move on, what about that bone issue you mentioned earlier? You said something about avascular necrosis. Sounds kind of scary.
It does sound alarming, but it's basically bone tissue death. It happens when the blood supply to a bone gets disrupted, which can lead to tiny fractures. And eventually, in severe cases, the bone can collapse.
So could that happen anywhere in the body?
Yes, but it most commonly affects the hips, knees, shoulders, and ankles.
So we're talking about real mobility issues here. That's a huge impact on someone's life.
It can be, for sure. And that's why early detection and treatment are so important. Speaking of which, I think it's time we shift gears and talk about how people can manage their lupus proactively.
I agree. We've talked about all the things that can go wrong, but let's focus on what people can do to take control of their health. That's what this deep dive is all about, right?
Yeah.
Empowering you with knowledge.
Absolutely. And that's exactly what we'll discuss next. So let's shift gears a bit and talk about what you can actually do to manage lupus proactively. It's not about just accepting the diagnosis. It's about being in the driver's seat of your health.
I love that, taking control. And knowledge is a big part of that, right? But we've talked about all these triggers. Sunlight, infections, even some medications. It can feel kind of overwhelming. Where do you even start?
I get it. It's a lot to take in. But let's break it down into bite-sized pieces, all right? First things first, let's talk about sunlight. We know it can be a big trigger for flares, especially for anything skin-related.
So does that mean if you have lupus, you got to become a vampire and avoid the sun completely?
Not quite.
It's all about moderation and protection.
Think of it as managing your sun exposure, not saying goodbye to it forever.
Okay, so what does that look like in real life?
Honestly, simple things can make a huge difference. Wearing protective clothing, hats, long sleeves, especially when the sun's really strong, like midday.
What about sunscreen? I know everyone should be wearing it, but is it even more important for someone with lupus?
Absolutely. Broad spectrum sunscreen, SPF 30 or higher, that's non-negotiable. And don't forget to reapply it every couple of hours, especially if you're sweating or swimming.
Makes sense.
Yeah.
Got to be sun smart, not sun avoidant.
Right. Exactly. And this brings us to another biggie, minimizing your risk of infections.
Right, because we talked about how infections can really mess things up for someone with lupus.
Yep. Remember that immune system is already working overtime, so any extra stress from an infection, it can set off a flare.
So what's the best way to keep those infections away?
Good old hand hygiene is your best friend. Wash your hands often with soap and water, especially after you've been out in public or around someone who's sick.
Hand washing, it's so simple but so important.
You said it. And along with hand washing, staying up to date on your vaccinations is crucial. Vaccines help protect you from preventable illnesses, and those can be especially dangerous for someone with lupus.
Okay, so talk to your doctor about recommended vaccines.
hmm
Got it. What else can people do to proactively manage their lupus? We've covered sun exposure and infections. Is there anything else that plays a big role?
There is, and it's something we haven't really dug into yet: stress management.
Ah, stress. Seems like stress is a factor in just about every health problem these days.
You're not wrong. Stress can really do a number on the body, and it's a well-known trigger for a lot of autoimmune conditions, including lupus.
So how does stress actually affect lupus? What's the connection?
When you're stressed, your body releases hormones like cortisol. Cortisol's helpful in small amounts, but when you're chronically stressed, it's like a constant flood of cortisol, and that can actually suppress the immune system and trigger inflammation.
So it's like stress just throws your immune system even further out of whack, and that makes lupus symptoms worse.
Exactly. That's why finding healthy ways to manage stress is so important for people with lupus.
Okay, stress management is key. But what does that actually look like day to day? What are some things people can do?
Oh, there are tons of options. It really depends on what works for you. Exercise is a great one. Even moderate stuff like walking or swimming can help.
I always feel better after a good workout, clears my head and all that.
Yeah.
What about those relaxation techniques? Do those play a role in managing lupus stress?
For sure, things like meditation, deep breathing, even just spending time in nature can really calm you down, both mentally and physically.
Like hitting the reset button on your stress levels?
Exactly. And don't forget about connecting with others. Support groups, online or in person, can provide a sense of community and understanding that can be huge when you're dealing with a chronic illness like lupus.
It's true. Knowing you're not alone makes all the difference.
And of course, we got to emphasize this: working closely with a qualified healthcare provider.
Right, this is all about empowering people with knowledge, but it's not a replacement for professional medical advice.
100%. Regular checkups, being open with your doctor about your symptoms, and sticking to your medication plan, those are all essential for effectively managing lupus.
So it's a team effort, you and your doctor working together to figure out the best approach.
Exactly. It's about finding that balance of medication, lifestyle changes, and emotional support to help you live your best life, even with lupus.
So even though there's no cure for lupus, there are things people can do to take charge and maybe even slow down how it progresses.
That's the key takeaway here. It's not a life sentence. It's a condition that can be managed. And you have the power to make choices that positively impact your health.
That's a great message of hope. But managing a chronic illness can be tough, both physically and emotionally. What about treatment options? We've talked about lifestyle changes, but are there medications that can help?
There are, and that's exactly what we'll dive into next: the different types of meds used to treat lupus and how they work.
All right, let's talk treatment. We've covered a lot, from those sneaky lupus symptoms to the triggers and the long-term stuff. But now, what can actually be done about it?
Treatment for lupus, it's not a one-size-fits-all kind of thing. It really depends on how severe your symptoms are and which organs are affected. Everyone's different.
So you don't just get a diagnosis and boom, everyone's on the same plan. It's much more personalized.
Exactly. And that's why working closely with your doctor, or even better, a rheumatologist who really knows lupus, is super important. They can help you navigate all the options and create a plan that's just right for you.
That makes a lot of sense. So what kind of treatment options are we talking about here? Give us the rundown.
Well, there's a whole range of medications used to manage lupus. Some of the most common are NSAIDs, those non-steroidal anti-inflammatory drugs like ibuprofen or naproxen.
Oh yeah, I've taken those for headaches and stuff. They're pretty good for inflammation.
They can be helpful for mild lupus symptoms like joint pain and muscle aches, but for more serious cases, you might need something stronger.
Like what? What else is out there?
Another common type is antimalarials. Funny thing is, they were originally developed to treat malaria, but turns out they're pretty good at managing lupus symptoms too.
That's kind of wild. A medication for one thing helps with something totally different.
Happens more than you'd think. Antimalarials can help reduce joint pain, skin rashes, fatigue, and they might even help prevent organ damage.
So they're like the multitaskers of lupus treatment.
Yeah.
What about those really serious cases, though, where there's organ damage? What can be done then?
For severe cases or when organs are involved, we might use immunosuppressants. These meds work by suppressing the immune system, which remember is kind of the root of the problem in lupus.
So, like dialing down the immune response so it stops attacking the body.
You got it. But with immunosuppressants, we got to be careful. Suppressing the immune system too much can make you more likely to get infections.
That's that double-edged sword we talked about earlier.
Right. It's all about finding that balance, controlling the lupus without increasing the risk of other problems.
Sounds like a delicate balancing act for sure. Are there any new cutting-edge treatments for lupus in the works?
There are. Research is always moving forward, and there are some promising therapies out there. One exciting area is biologic therapy. Biologics are like genetically engineered proteins that target specific parts of the immune system.
So it's a more targeted approach instead of just suppressing the whole immune system.
Precisely. That's the great thing about biologics. They can be much more precise, which can mean fewer side effects.
That's really good to hear.
Huh.
Okay, with all these treatment options, can lupus be cured?
Ah, the big question. Unfortunately, there's no cure for lupus yet. BUT, with the right treatment plan and some proactive management, lots of people with lupus can live full and active lives.
So it's about managing it, not letting it control you, about taking charge and making choices to live your best life.
Absolutely. And that's really what I want you to take away from today. A lupus diagnosis, it's not the end, it's just a new path. It might require some adapting, some learning, and a good support system.
We've covered so much today. It might feel like a lot. What's the one thing you want our listener to remember from all of this?
I'd say the most important thing is this. Knowledge is power. The more you know about lupus, the symptoms, the triggers, the treatments, the better you'll be able to manage your health and advocate for yourself.
Couldn't agree more. Don't be afraid to ask questions. Do your research. Talk to your doctor.
Exactly. You are your own best advocate.
So well said. And if I could add one more thing, don't lose hope. Research is moving forward. Treatments are getting better all the time. There's always reason to be optimistic.
I'm with you on that. And as we wrap up this deep dive, one final thought for you. Thinking about everything we've talked about, what steps can you take starting today to really prioritize your health and maybe even lessen the impact of lupus on your life? Something to think about.
I love that. It's about taking all this information and putting it into action.
Remember, this deep dive is just the beginning. It's not a diagnosis or a treatment plan. It's about understanding and feeling empowered.
So keep learning, keep asking questions, keep the conversation going with your doctor. They're your partner in all of this.
And never forget, you're not in this alone. There's a whole community of people living with lupus, ready to support you and share their experiences. You've got this.
Thank you so much for joining us on this deep dive into lupus. We hope it's been helpful and empowering.
Until next time, stay curious, stay informed, and stay well.